A Patient's Guide to Parathyroid Surgery for Hyperparathyroidism. Hello. This is an educational video designed to improve your understanding and overall experience for your surgical treatment of hyperparathyroidism. Please pay attention to the following materials for your safety and optimal treatment results. Hyperparathyroidism. Parathyroid glands are endocrine organs that are located on the back of the thyroid gland and produces parathyroid hormones. Parathyroid hormones ultimately increase blood calcium level by increasing the breakdown of calcium from bones, preventing urinary calcium loss, and increasing absorption of calcium from dietary intake in setting of normal vitamin D function. Hyperparathyroidism refers to overproduction of parathyroid hormone due to hyperfunction of one or more parathyroid glands, and it is classified as primary, secondary, or tertiary. Primary hyperparathyroidism. Primary hyperparathyroidism refers to an enlargement of one or more of parathyroid glands leading to overproduction of parathyroid hormone and subsequent elevation in blood calcium level. 80 to 85% of primary hyperparathyroidisms are caused by a single adenoma, or a tumor of the parathyroid gland. The rests of primary hyperparathyroidisms are caused by multiple abnormal parathyroid glands. Parathyroid cancer accounts for less than 1% of hyperparathyroidism. In rare cases, hyperparathyroidism may accompany genetic syndromes known as multiple endocrine neoplasia syndromes. Secondary hyperparathyroidism. Secondary hyperparathyroidism refers to excessive parathyroid hormone secretion in response to relatively decreased blood calcium or vitamin D level. Chronic kidney failure is the most common cause of secondary hyperparathyroidism. Tertiary hyperparathyroidism. Prolonged state of secondary hyperparathyroidism and stimulation for excessive parathyroid hormone production may ultimately lead to autonomous parathyroid gland function referred to as tertiary hyperparathyroidism. Tertiary hyperparathyroidism diagnosis is established when hyperfunction of parathyroid glands persist even after the cause of secondary hyperparathyroidism has been corrected. Symptoms of hyperparathyroidism. Only about half of the hyperparathyroidism patients experience any symptoms. If present, these symptoms are nonspecific, such as generalized weakness and fatigue. However, if left untreated, certain patients may experience more severe complications such as osteoporosis, kidney stone, digestive problems, constipation, cognitive impairment, depression, and generalized body aches. Treatment method for hyperparathyroidism. Since over 80% of primary hyperparathyroidisms are caused by a single gland disease, a localization study followed by a resection of the overfunctioning gland, using a small and focused neck incision can cure the disease. In certain places, endoscopic hidden scar parathyroidectomy surgeries may be performed. However, when multiple parathyroid glands involved or concurrent thyroid pathology exist, more extensive surgery may be required involving larger incision. In case of a 4-gland disease, subtotal parathyroidectomy performed, where 3.5 glands are removed, leaving the normal appearing and sized parathyroid tissue. Preoperative preparation. Prior to the surgery, ultrasound exam is performed to localize the enlarged parathyroid tumor. Do not eat or drink past midnight prior to surgery. Please talk to your doctor regarding your home medications prior to the surgery. Surgical procedures. The surgery can be performed under a general anesthesia or using local anesthetics. Depending on the surgical approach, duration of surgery can be 1 to 3 hours. Surgeon will send multiple blood samples during the surgery to check appropriate drop in the level of parathyroid hormone. Once the specimen is out, to confirm the source of hyperparathyroidism has been successfully treated. Sometimes frozen section biopsies are performed to establish the tissue diagnosis and confirmation. At the end of the case, surgical field is surveillance for any source of bleeding. The skin incision is closed to finish the case. Post-operative care. Most of the focused parathyroidectomy patient will go home the same day after few hours of observation. Incisional pain along the neck is usually well tolerated, and patients are able to drink and eat few hours after the surgery. Depending on the extent of the surgery, patient's medical history, or doctor's preference, patients may stay overnight in the hospital for observations. Complications after the surgery. Hypoparathyroidism and hypocalcemia. After a successful parathyroidectomy operation with removal of overactive parathyroid glands, relative decrease in the parathyroid hormone level, and subsequent drop in the blood calcium level may cause numbness and tingling around your mouth and your hands. If untreated, your symptoms may progress to muscle spasms, cramps, or even life-threatening heart or neurological problems. These symptoms generally start 1 to 2 days after the surgery. Treatment is typically calcium and vitamin D supplements by mouth, but in severe cases, you may need to be admitted for an IV calcium infusion treatment. These are almost always transient problems until the residual parathyroid glands in your body regain normal function. Please talk to your doctor if you are experiencing any of these symptoms for a timely intervention. Post-operative wound care and complications. Please talk to your doctor about specific instructions regarding your wound and dressing care. In general, your wound is covered with a dressing or skin glue. No suture removal is necessary typically. After the discharge, you can carefully resume your daily activities to move and stretch your neck as tolerated. You may shower about 2 days after the surgery. For best cosmetic outcomes, try to avoid prolonged direct sun exposure. Parathyroidectomy wounds generally heal very well with excellent cosmetic outcome. Mild numbness and any skin bruises will improve over time. However, more serious wound complications can occur, including infection and bleeding. If you notice worsening redness, swelling and pain around the surgery site, visit your doctor for possible wound infection and need for an antibiotics treatment. You may experience a mild swelling or fullness from a normal healing process or a simple fluid collection, which often are self-limited. However, if you experience a sudden bulge or an enlarging firm mass in your neck, you need to seek a medical attention immediately for potentially a life-threatening bleeding complication. Despite a sound surgical technique and bleeding control during the operation, delayed bleeding can occur in the neck. Post-operative bleeding in the neck may compromise the airway due to an obstruction, and therefore requires immediate medical attention. A timely surgical intervention is necessary to evacuate the blood and for bleeding source control. Nerve injury. During the parathyroid operation, The nerves that innervate the vocal cords for making sounds can be injured, leading to significant voice change. Most of these injuries are transient, but rarely permanent injuries can occur. Risk of recurrence. Few percentages of patients may experience persistent or recurrent hyperparathyroidism. Please follow up with your doctor for an evaluation of recurrence based on your symptoms and blood tests. This concludes the educational video on surgical management of hyperparathyroidism. Thank you.